Wendy and Bill meet with Dr. Stanley Frileck, a renowned plastic surgeon in Brentwood, California.
Hi, Wendy. I'm Dr. Frileck. How are you? Good to meet you.
Good, thank you.
Hi. You're Bill, right?
Yes.
Good. Nice to meet you. Without looking in the mirror, describe your nose to me and the way in which you don't like it. When Wendy first came to me, we talked about the way she felt about her face, and in particular, her nose. And a secondary concern was the relationships of the different features on her face. You mentioned your eyelids and the puffiness in your eyelids. That's the fat, which is in fact what's causing the puffiness. The other thing that I've noticed is there's a fullness in your neck which doesn't show your jawline to advantage, so that your cheek tends to slide into your neck rather than stop at the jawline.
Given many options, Wendy decides on more than just a nose job. She's going to have her lower eyelids lifted, liposuction under her chin, and fat injected into her cheeks. It's the day of the surgery. Dr. Frileck photographs and marks Wendy's face.
It's really a roadmap. It's not incisions or things like that. There are no ideals out there. There's only what's in front of you. And what's in front of you really articulates perfection. It's taking the beauty of what's there and reconciling it with that person's perception of how they look, and that defines perfection.
Since the surgery, I feel a lot better about myself. I feel more confident, more secure, a little more, I think, outgoing. It's definitely boosted my ego.
Color is amazing.
When I look in the mirror now, I see the girl that I always should have been.
You look gorgeous.
I love it.
You love
It's
it?
amazing.
Yeah.
43-year-old Shelley Carney has been insecure about her looks for as long as she can remember.
I'm not positive exactly when, but I know it was, around age 6 or so. I became aware that I wasn't the beauty.
The oldest of 4 girls, Shelley always felt less attractive than the rest of her family.
The memories of my childhood are very vivid. I have very beautiful parents, I have very beautiful sisters, and I didn't feel that I fit in. I was told at some point, "Oh, Shelley, don't you worry. You get a little older, you can wear makeup." And that was just devastating.
Today, Shelley gathers the courage to meet with Dr. Stanley Frileck, a plastic surgeon in Los Angeles, California.
Hi, Shelley.
Hi.
I'm Dr. Frileck. How are you? Nice to see you.
Nice to see you too.
Come sit down.
Thank you.
And let's chat a bit. Describe the things that are going on when you look in the mirror and the features on your face that you think fight your face.
I just have never felt like my face was even.
When Shelley first came to me, she had a certain number of concerns, not only about the surgery, but more importantly about what changes would take place on her face. Now, it's true that your nose does dominate at least the mid portion of your face. It's also true that the slope of your chin plays into the domination of your nose. So at least one of the things that would be done is to bring the projection of your chin out a little bit. Your cheekbones do have a certain flatness to them, especially in relationship to your nose. And that might be another area to embellish and recontour.
As for what he suggested, it didn't seem over the top. It didn't seem extensive. I showed him pictures of my family. I told him, make sure that I fit into this group. Look at my beautiful mother, look at my beautiful father. He heard me.
On the morning of the surgery, Dr. Frileck marks lines on Shelley's face to guide him through the many procedures. She's photographed and then taken into the operating room. After nearly 9 hours, Shelley is bandaged and wheeled into recovery.
Shelley's transformation should be, to all intents and purposes, nothing short of dramatic.
3 months after a full facial restoration that included an eye lift, a facelift, a nose job, and fat grafting, Shelley has something new to see when she looks into the mirror.
You want to see it?
Let's see, let's see. Oh my, it's even better than I hoped for. I look good. I'm still me, and I still see that same person inside myself. But now, it's reflected in the mirror as well. I look like I thought I should have looked like in the first place. You know, I feel liberated. The difference is the lack of fear. And without that fear, I've got a whole lot more to give to the rest of my life.
You look beautiful.
Oh,
enjoy.
Thank you, sir. I didn't realize how much that cost me. I know what it's like to walk out of the house completely confident about the way I look.
The reason that plastic surgery is such a unique specialty is that there are, in fact, no standard operations. There's an operation that we're going to develop for your face that will restore your face, that will be unique to you and something that I may not do in anybody else.
Since each facelift is unique, Dr. Frileck uses old photographs of Casey to get a better idea of how she aged in the past 30 years.
This is my high school picture.
Let me tell you about older photographs and why I use them. If you look at this high school picture, you can see you've still got a lot of the baby fat in your face. Your jawline is nice and smooth. And that's certainly an achievable thing with you.
Good morning. Nice to see you. So good of you to come.
2 days later at 6 a.m., Casey arrives with her fiancé at Dr. Frileck's office for the 6 to 8 hour operation. Dr. Frileck takes a series of photographs of Casey's face that he can study after the surgery to make sure everything he has planned works.
You love it?
I love it.
3 months after her surgery, Casey is in full swing as she returns to her busy life as a grandmother and soon-to-be new wife.
I think I look pretty great.
Happy with her new face, she looks as young as she feels.
Dr. Frileck said something when we were first in consultation when I said, I don't want to look really different, I just want to look better. And he said, you're going to look more like yourself than you do now to yourself. And I didn't really know what he meant, but now I do. I look in the mirror and I think, oh, that's me.
Jerry is determined to downsize and looks to Dr. Stanley Frileck of Brentwood, California for a solution.
You can do your gown back up again.
Jerry's weight will influence how much tissue is removed.
At my lowest weight, I've always been large-chested. At my heaviest, it doesn't really fluctuate very much. I've always been pretty much a 34 Blvd.
Good. That was my next question, because people do lose weight in different areas, and sometimes the breast is indeed a target for that weight loss, and other times it isn't. I don't usually deal in cup sizes,
Right.
but will reduce you to something that's relational to your body size and build.
The markings indicate incision lines and act as guidelines for the final placement of Jerry's breasts.
So those markings are fairly specific.
I know I'm in good hands. I think I'm just overwhelmed. I'm happy. I've been wanting to do it for so long. I'm doing it.
The operating room is a strange and wonderful place. It's a place of details. As Einstein once said, God lives among the details. The actual surgery is a relatively shorter time in the procedure than the closure, which has to minimize the scarring and make it look like I haven't been there.
At the end of surgery, the amount of tissue and fat removed from Jerry's breasts totals 590 cc's, or roughly 10 ounces.
The amount of breast tissue removed in Jerry's case was a little bit low normal. What I didn't want to happen was, at some point when she loses the weight that she may in fact lose, I didn't want her breasts to correspondingly go down too much. It's why plastic surgery is so fascinating. If it's done well, if it's done with artistry. Well, she got a nice shape to her breast.
I'm going to probably need to take a little more off the bottom here, and I'll do that with a little liposuction contouring.
One of the risks is that you may outstrip the blood supply to a small portion of skin. In Jerry's case, we sent her to a hyperbaric chamber.
Hyperbaric or pressurized oxygen chambers have been used for almost a century to treat divers with the bends. In the last 10 years, their use for surgical patients has exploded.
I would totally do it again. I'm very, very happy. The time and energy, money, all of the above is so worth it. It's just something that I've always wanted to do, and I did it finally.
Dr. Stanley Frileck, a renowned plastic surgeon in Los Angeles.
There's one issue in a youthful face, and one only, and that's smoothness. Not attractiveness, not even cheekbones or eyes or mouth or neck or jawline, it's smoothness. And that's the main objective in doing a facial restoration. But Judy is by no means an unattractive woman, but the age-related changes that have literally taken over her face have sort of obscured her attractiveness.
Old photographs allow Dr. Frileck to examine Judy's face before the aging process took its toll.
They allow me to see the types of photos that the patient selected, because it gives me a little bit of a clue of what they like.
But that's kind of how I would like to look, except with, obviously, with a little more texture on my skin.
In the end, Dr. Frileck suggests a full facial restoration for Judy. The process will include a brow lift, an eye lift, a mid-face lift, and fat grafting in her cheeks and around her mouth.
Dr. Frileck said something to me that was very interesting, that's really stuck. He says, I know what you're worried about. He said, you don't want to lose your Judiness. And that's it in a nutshell. I don't want to lose my Judiness.
On the morning of the surgery, Judy's best friend Marlene is by her side.
Relax your face, look straight ahead.
Dr. Frileck takes photos of Judy to use as reference while in the operating room. He then creates a roadmap for the 8-hour journey ahead.
The artistry in this work is in the decision-making, not so much in the surgery.
You know, you walk out of an operation like this having reversed in 8 hours what it's taken 20, 30 years to achieve.
3 months after the procedure, Judy feels she looks more herself than ever before.
The interesting thing is that before I had the surgery, whenever I looked in the mirror, there was a little shock because I didn't look the way I felt inside. I looked older than I felt inside. And now, when I look in the mirror, it's like seeing myself as I think of myself. Well, my friends have reacted 100%, really, not even 99%. The response has been 100% positive.
Thanks, Romeo.
57-year-old Marcia Posner is a successful fashion consultant in New York City. It's a business where appearance is everything and plastic surgery is common.
Have you seen a lot of these collections out of here? Because I want to sit down and talk to you later.
A lot of my friends had had plastic surgery, and I never entertained the idea that I would have it. I jog, I watch what I eat, I do all those things, and I really feel really good about myself and my health. And one day I was in the subway and somebody said, oh, why don't you take my seat? And that was like it. I said, oh my God, I look like an old lady to this young person. I said, I am thinking now about plastic surgery.
Marcia wants a facelift.
My neck definitely bothers me the most. I really don't focus on the negatives about my face, but I definitely see it in my neck.
Marcia searched all over for a plastic surgeon she could trust. Dr. Stanley Frileck came highly recommended. The only problem was he lived 3,000 miles away in Los Angeles, California.
I had her digitize me some photographic images that she emailed. It was a good starter for our conversation.
I'm flying out to California and to meet with Dr. Frileck. And if I like him and I feel comfortable, I'll go through with it. But if there's something that hits me in the negative, I am very fast to say, I can't do this.
Let's chat a little bit about some of the things that are bothering you about the way your face is aging.
What I'm really concerned about is my neck. Like, I just woke up one morning and my neck was wrinkled. When I met with Dr. Frileck, he mentioned that if he just does my neck, that it wouldn't really be worth it because it would be, he really wants to get a whole look.
Facelift is an unfortunate name. It's a face repositioning. It's taking the tissues that have fallen, putting them back by some means, and hiding the fact that you were there.
Dr. Frileck suggests altering Marsha's nose as well.
The bridge needs to be narrowed a little bit, but we're talking about millimeters. So it can still be the essence of your nose, yet much more refined.
Overall, Dr. Frileck recommends 5 separate procedures, including a brow lift, an eye lift, a facelift, a nose job, and fat grafting around Marsha's chin and mouth.
After I met with Dr. Frileck, I said, this is the person for me, and I decided, I had such confidence in him that I decided to call my husband and I said, I'm doing it. And he said, I knew you would. I didn't tell him anything was happening with the nose, because he would kill. He hates nose jobs.
In the operating room, Dr. Frileck pulls up photos of Marsha on his computer to use as a guide throughout the operation.
The position of her eyebrows sets the stage for everything else that you do in the eyes and then later on in the face. Closing takes up most of the time. You have to match everything up. You have to get a great scar. You have to hide the fact that you were there. That takes all the time.
After 10 hours, she's bandaged and wheeled into recovery.
Actually, the surgery went very well.
After about, I'd say 2 months, we were having dinner and he looked at me and he said, I have to admit, you really look good. And then he also said, I have to tell you too, your neck was really bad. So that made me feel really good that he finally came around.
I'm actually surprised how pleased I am with the results. I mean, she really looks beautiful.
And most importantly, Marsha feels beautiful.
I was afraid that it would look very, very different when I first had it done, but I loved the results. In the end, it was worth freaking my husband out because he got over it, and now I think he really doesn't remember what I used to look like.
41-year-old Casey Wong can give most moms a run for their money.
And after snack, I want you to get your baseball outfit on. Jonathan, where's your bat?
It's in my bag.
We just gotta find your hat.
My kids have nicknamed me Mom Racer because I'm always racing around.
Glasses, check. Hat, check.
And everything is, come on, let's go, 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 go.
But prior to motherhood, this Southern California beauty was on the brink of a successful modeling career.
I started modeling back when I was about 17. I ended up doing mostly swimwear, which I really enjoyed because I seemed to have kind of the California girl, all-American look that people enjoyed. And one of the things that I knew that was holding me back was that I had a nose that was large. People would say, you know, have you thought about doing something about that? And so when I was about 21, I decided to get my nose done. It looked as though nothing was really accomplished. So I went back a second time. The result was a concaving, kind of a divot in the left side of my nose. At that point, I was so distraught. I didn't think that there was any hope at all left for me in this nose. I just felt I'm just gonna have to just, you know, deal with the fact that
rhinoplasty didn't work for me.
The 2 failed surgeries caused her self-esteem to plummet, and criticism on photo shoots didn't help.
Imagine I'm testing for a photo shoot for a photographer, and there's a makeup artist that's working on my nose and hemming and hawing. She can't seem to get, the lighting right.
In a last-ditch effort to salvage her dream, she had no choice but to go under the knife a 3rd time, a move that left her permanently disfigured.
Upon the 3rd surgery, the doctor had scraped out with a scalpel the cartilage, therefore giving me this kind of a scooped little elf kind of projection.
For now, Casey has given up modeling, instead finding fulfillment as a mother and wife.
My husband is very, very supportive of my needs, and he wants me to be happy with myself.
She meets with Dr. Stanley P. Frileck to discuss her nose and other concerns.
The tip of your nose projects from your face too much for the bridge and the what's called the super tip. And so one of the aims of the procedure will be to bring back that tip into your face. By all odds, she has a right to expect a good nose. I, on the other hand, only expect a great nose. Somewhere in between that, I'm gonna have to stop. Anything else going on?
I feel like I'm kind of losing my eye and need some kind of a lift here.
Mm-hmm. In the face, very small physical movements, physical changes of particular features produce very dramatic impact. In elevating your brow, it's only a matter of 2 or 3 millimeters.
Now that I have 2 children, and I breastfed both of them, I lost a lot of breast tissue. And it's bothersome because I'd like to be able to look good in a bathing suit again and feel confident.
Let me slip your gown just down around your elbows. You would have to beat me up severely to get me to do a breast lift on you, because there's relatively little gain from that. And you get permanent scars on your breast. In putting an implant in your breast, there'll be a certain amount of lift that goes on. You can put your gown back on.
In all, Casey elects silicone breast implants, followed by a brow lift, upper and lower eye lift, lip augmentation, and corrective rhinoplasty. Today, she's not quite ready for the runway, but glamour has definitely made a comeback.
I feel better about myself. I feel glamorous. Sometimes when I look in the mirror, I see myself like I did when I was in my 20s. I think you took like 20 years off, maybe 15. On good days, 20. My breast augmentation, I am very happy with. They look natural. They look really natural. I mean, you would not be able to tell. I think that's nice. I have had 4 nose jobs. This is the last one. Now, there will not be a 5th. It works well. I can breathe. I love the results. I feel that since I've had the surgery, I feel more optimistic about life in general. I feel like I look younger, so it's okay to act younger.
It's perfect. It's exactly what I want. Yay! Life is good. I can balance a lemon twist on my nose.
I knew you had to.
What I'm considering for the future is getting back into modeling right now, seeking representation. Also, acting is a dream that I've always had. That would be wonderful. I have a lot to offer and a lot to give.
All right, Charlie, we have another story for you out of California this morning, and it's a special contributor, Patty Davis, daughter of President and Mrs. Reagan, who has written a number of essays you may have read, eloquent and provocative essays about her life. Well, this morning, an extraordinary personal story, because in this era of unquestioned plastic surgery, she's going to tell you what happened when she decided to change her nose and learned, among other things, that fixing plastic surgery is now a specialty all its own.
I thought it was probably a good idea to maybe be able to breathe properly when I was sleeping for the state of my marriage. I thought this was going to be a really simple thing, that I'd come out and I'd have an attractive nose and also be able to breathe, neither of which happened. Most of the cartilage was taken out, hence the shapeless, mushy thing that I ended up with. It was also broken unevenly, and my breathing, I think, ended up even being worse. And I walked down the aisle in my pretty dress, smiling with a very wide, shapeless nose. I didn't hate my nose before. I did hate it afterwards. If I could have gone back to my old nose, I would have done that. I thought, well, I've got to get this fixed. So I went to another doctor and get confused for the next 3 surgeries. One of them actually made it even more lopsided. Lopsided, so it was good, and still I couldn't breathe. I thought, if we can go to the moon, why can't I get my nose fixed?
The nose is arguably the most difficult operation in plastic surgery because there's an infinite number of variations that you can put on a nose.
After 4 disappointing surgeries, I turned to this man, Dr. Stanley Frileck, one of the few plastic surgeons in the country who specializes in redoing procedures that didn't go right the first time. How much of your practice is redoing botched jobs?
About 25 to 30% of my practice is that, and that's a growing number.
One of the first things he said to me, it might have been the first thing after hello, was, your nose doesn't fit your face. And I went, oh, thank you. You know, because no one else had said that. I knew that to be the case. I knew that, that I had this sort of wide, shapeless, cute. That was the buzzword for me. If someone said, oh, your nose is cute, I'd go, well, you're not operating on my nose.
That very notion that somebody might think your nose is cute is the essence of what we're talking about. Mm-hmm. It's his or her take on your nose, your face. And when that doesn't jibe with the way you think about it, there's a problem right off the bat.
After my own mistakes, after years of research, asking questions, talking to experts, here's some things you need to know. It's important to ask a surgeon for photos of his or her work and talk to other patients. Make sure your doctor is certified by the American Board of Plastic Surgery. This is surgery, a serious medical procedure. On the one hand, it's a good thing, I think, that plastic surgery is being talked about more. On the other hand, when they look at a show like, say, Extreme Makeover, it seems like easy, risk-free, you know, you're going to have all of your expectations met and all of your fantasies met.
People are influenced by this presentation in the commercial media that things are quite a bit easier. The sad fact is that new techniques in plastic surgery require sometimes 5 or 10 years before they're vetted in a way that says not only are they safe, but they're effective, they do work. So jumping on the bandwagon on year 1, it's like buying the first edition of a car or a television set or whatever you have. There are bugs in it.
18 years after my first surgery, I went in for number 5 with Dr. Frileck and finally got it right. From the moment I came out of surgery, I could tell that, particularly from my profile, that I didn't have this scooped up nose anymore. I had a nose that was more fitting for my face. I could already breathe better. And that's after surgery. I was going, oh my God, I can breathe through both sides of my nose, and it's startling. This is how other people breathe.
And our thanks to Patty Davis for her personal story.
When 34-year-old Paula Motter decided to make her life over, diet and exercise was just the beginning.
I've always hated that my chin was very short, and then under here, there was always, it looked almost like I had a double chin.
With the hopes of reconstructing her profile, Paula first consulted an oral surgeon.
I actually should have had a surgery that would break my jaw and bring it forward. And then I'd still have to wear braces again for another 2 years. And at this time in my life, I don't want that.
To discuss her options, Paula meets with one of LA's top surgeons, Dr. Stanley Frileck.
So talk to me a little bit.
I want a nicer profile. I just feel my chin's very short, and under here, I feel like I have like a lot of extra skin, and not a lot of definition. Can't really see my cheekbones when I look at my profile. I've already been to an orthodontist who wanted to break my jaw, and I just really did not want to go through that process.
We're going along a different avenue to add some projection without dealing with the actual mechanics of the way your jaw moves. And that's, in many ways, what a lot of cosmetic surgery is all about.
Okay.
In your case, we can fashion a chin implant that will bring forward the projection of your chin and also widen the front view of your chin so it matches more the way the angle of your jaw is wide. By both bringing your chin forward and creating a better angle in your neck, the definition under your jaw and the definition in your neck and chin will be much better to balance out your face.
Okay.
What we haven't discussed is your eyes and the way your eyes are framed.
I wasn't even thinking about that, but it has become a problem. Very dark underneath my eyes, and I can't. No concealer is taking that away.
There's an absolute fullness in your upper and lower lids that requires a certain amount of fat removal. The idea is to create smoothness in your lower lid. And we're going to define a little better your upper eyelids and give you a little more crease, especially on the outside where the heaviness is.
In all, Paula decides to go through with a chin implant, neck lift, fat recontouring, and an eye lift.
We're going to take some photos now, and then I'm going to do some drawing on your face.
Okay, I'm ready.
9 weeks later, the incisions are imperceptible, and so is Paula's insecurity.
I like my profile. I'm not embarrassed to wear my hair back anymore. Now that I have my chin implant, obviously the whole shape of my face has changed. It's not so round anymore. My eyes really surprised me. I hadn't even intended to do my eyes, and that, I think, really was the cherry on the sundae. I scheduled a photo shoot. I want some photos taken to give to my friends and family and to help promote my business. Sexy. Being an esthetician, you're judged by who you work on, if you've been in a magazine, and I was never confident looking for that kind of press.
Fashion.
I used to run from the camera. Now I'm realizing that taking pictures is fun.
Tricked you, sorry, that probably.
I just feel more polished, more balanced. People tell me I look young for my age. I feel like I've cheated a little bit, but I wouldn't change it for the world.